Glaucoma. Silent vision loss. Why you must go beyond routine. Eye care. Most people believe that if they can see clearly, their eyes are healthy. But glaucoma doesn't work that way. It is a silent condition. No pain, no early warning, and often no symptoms until significant vision is already lost. Let me share a real example. A 77-year-old retired Navy officer, active, disciplined, no eye complaints, went for a routine checkup. And suddenly, he was told, "You have glaucoma. It may worsen. You need lifelong treatment to prevent vision loss." He felt completely normal, yet damage had already begun. So the question is, are routine eye checks enough? Or do we need to go beyond them to truly protect our vision? In this video, we'll explore exactly that. Let me begin with a real story. A 77-year-old gentleman, Abung from Thailand, a retired Navy officer, disciplined, active, and mentally sharp, had absolutely no complaints related to his eyes. No pain, no blurring of vision, no difficulty in daily activities. Like many of us, he believed that absence of symptoms meant absence of disease. During a routine medical checkup, he visited an ophthalmologist as part of standard screening. After a detailed examination, the doctor told him something that changed his life. "You have glaucoma. It may worsen over time. There is no cure. You will need to use these eye drops for the rest of your life to slow the progression. If you do not follow instructions strictly, you may lose your eyesight." Imagine the impact of hearing this when you walked in feeling completely normal. This is not a hypothetical case. This is the story of our own neighbor, a man who served his country, maintained discipline throughout his life, and yet a silent disease had already begun damaging his optic nerve without any warning. The real danger of glaucoma is not just the disease itself, but the silence with which it progresses. Let this not happen to someone else. Let us understand this condition deeply so that we can detect it early, prevent its progression, and protect vision before it is too late. Glaucoma is often misunderstood as simply high pressure in the eye, but this is an incomplete and potentially misleading concept. Scientifically, glaucoma is a progressive optic neuropathy, meaning it is a disease of the optic nerve, the structure that carries visual information from the eye to the brain. While increased intraocular pressure is a major risk factor, many patients develop glaucoma even with normal pressure levels. According to the American Academy of Ophthalmology, glaucoma involves complex mechanisms, including impaired blood flow to the optic nerve, mitochondrial dysfunction, oxidative stress, and neuroinflammation. In simple terms, the nerve gradually loses its ability to function and eventually dies, leading to permanent vision loss. The most critical point to understand is that vision loss from glaucoma is irreversible. It typically begins with peripheral vision, which is why patients do not notice it early. By the time central vision is affected, a significant portion of the optic nerve has already been damaged. This is why prevention and early detection are not optional. They are essential. Waiting for symptoms is a mistake. The correct approach is proactive screening and protection. Certain individuals are at higher risk. Age above 40, family history of glaucoma, diabetes, hypertension, and especially insulin resistance significantly increase susceptibility. High myopia, prolonged steroid use, and sedentary lifestyle further compound the risk. The underlying reason is that these factors impair microcirculation, increase oxidative stress, and compromise mitochondrial efficiency, all of which are crucial for optic nerve survival. In its early stages, glaucoma is usually asymptomatic. Subtle signs may include difficulty in dim light, mild eye strain, or gradual loss of peripheral awareness. However, most patients notice nothing until advanced stages. Late symptoms include tunnel vision and eventually central vision loss. If ignored, glaucoma can lead to complete blindness, loss of independence, increased risk of falls in the elderly, and even cognitive decline. Vision is not merely about seeing, it is about autonomy, dignity, and quality of life. Modern ophthalmic care remains the cornerstone of glaucoma management. Eye drops that lower intraocular pressure, laser therapy, and surgery when necessary are essential interventions. However, an important limitation must be acknowledged. These treatments primarily address pressure. They do not fully address blood flow, metabolic dysfunction, or neurodegeneration. This is where an integrative approach becomes valuable, not as a replacement, but as an extension of care. To truly protect the optic nerve, we must focus on three pillars: pressure control, vascular health, and neuroprotection. The optic nerve is highly dependent on continuous blood supply and efficient energy production. Any compromise in microcirculation or mitochondrial function accelerates damage. Therefore, improving vascular health becomes a central strategy. One of the most powerful and accessible interventions is regular physical activity. Exercise improves insulin sensitivity, enhances blood flow, reduces oxidative stress, and even modestly lowers intraocular pressure. Particularly important is post-meal walking for 10 to 15 minutes, which reduces glucose spikes and protects the vascular endothelium. This is not a minor detail. Repeated glucose spikes are one of the most damaging factors for microcirculation, including the delicate vessels supplying the optic nerve. Diet plays an equally critical role. Glaucoma does not begin in the eye alone. It often begins in the bloodstream, shaped by years of metabolic imbalance. Diets rich in fresh vegetables, fruits, nuts, seeds, and healthy oils support vascular integrity and reduce inflammation. Leafy greens improve nitric oxide production, enhancing blood flow. Berries provide antioxidants that protect retinal cells. Healthy fats, such as those from olive oil, mustard oil, and seeds, support neuronal membranes and reduce inflammation. Before we go further, let me ask you something honestly. If glaucoma has no symptoms in the early stages and vision remains normal for a long time, how would you even know you have it? This is exactly where most people miss it. Not because they are careless, but because the disease is silent. And this is why just routine checking is sometimes not enough. In the next few minutes, I'll show you what actually makes the difference. What protects the optic nerve beyond just eye pressure. In contrast, ultra-processed foods, refined vegetable oils, sugary beverages, and packaged snacks promote insulin resistance, oxidative stress, and endothelial dysfunction. These dietary patterns silently damage the microcirculation over years. The optic nerve, being highly sensitive to oxygen and nutrient supply, becomes vulnerable in such an environment. Every meal either improves blood flow or gradually impairs it, and the optic nerve depends entirely on that flow for survival. Traditional dietary components also offer supportive benefits. Turmeric, especially when combined with black pepper, provides curcumin, a potent anti-inflammatory and antioxidant compound. Ginger improves circulation and insulin sensitivity. Fenugreek helps reduce post-meal glucose spikes, thereby protecting blood vessels. Apple cider vinegar, when used appropriately, can improve insulin sensitivity and blunt postprandial glucose surges. These are not treatments for glaucoma, but they help create a metabolic environment that slows disease progression. Vitamin support is another important aspect. B vitamins, particularly B1, B6, B9, and B12, play a critical role in reducing homocysteine levels, a known vascular toxin. Elevated homocysteine is associated with impaired blood flow and increased neurodegeneration. Magnesium supports vascular relaxation and nerve function, while maintaining adequate vitamin D levels supports immune modulation and overall health, though excessive dosing should be avoided. Breathing practices, chanting, and humming may appear simple, but they have profound physiological effects. Deep, slow breathing activates the parasympathetic nervous system, reducing stress and improving vascular tone. Humming has been shown to increase nitric oxide production in the sinuses, which can enhance blood flow. Chanting stabilizes neural activity and reduces cortisol levels. These practices contribute to a more balanced autonomic state, which indirectly supports optic nerve health. Emerging modalities, often referred to as energy medicine, can also be viewed through a physiological lens. Techniques such as infrared light therapy may enhance mitochondrial function and reduce oxidative stress. Sauna therapy improves circulation and metabolic health. Exposure to natural environments, or biophilia, reduces stress and improves cardiovascular function. Grounding, PEMF, hydrogen therapy, and vagus nerve stimulation have varying levels of evidence, but many share common pathways: improving circulation, reducing inflammation, and enhancing cellular energy. While some of these remain experimental, others like exercise, sunlight exposure, and stress reduction are firmly grounded in science and highly beneficial. There are also certain traditional compounds that have shown interesting benefits for eye health. One of them is saffron. Saffron contains active compounds like crocin and safranal, which have antioxidant and neuroprotective properties. Pause. Research suggests that saffron may help protect retinal cells from oxidative stress and may improve visual function in certain degenerative eye conditions. Now, it is important to understand, saffron is not a treatment for glaucoma, but it may support the health of the retina and optic nerve. By reducing oxidative damage and improving cellular resilience. In that sense, it fits into a broader strategy of protecting vision from within. Saffron does not treat glaucoma, but it may help create a healthier environment for the cells that preserve vision. Some small clinical studies have shown improvements in visual function with saffron supplementation, particularly in age-related eye conditions. The key message is integration. Eye drops control pressure, but lifestyle and metabolic strategies protect the nerve. The future of glaucoma care lies in combining modern medicine with intelligent lifestyle interventions. This includes regular screening, especially after the age of 40, maintaining metabolic health, engaging in daily physical activity, consuming a nutrient-rich diet, managing stress, and supporting vascular function. Let us return to the story of Abung. His condition was detected early, but many are not as fortunate. The difference between preserved vision and blindness often lies in awareness and timely action. Glaucoma does not take vision suddenly. It takes it slowly over years of neglect. But that also means we have an opportunity, a window to act, to intervene, to protect. Vision is one of the most precious senses we possess. It allows us to connect with the world, to move independently, to live with dignity. Protecting it requires more than medication. It requires understanding, discipline, and a holistic approach. If we act early, think integratively, and respect both modern science and lifestyle wisdom, we can significantly reduce the burden of this silent disease. Let this knowledge not remain theoretical. Let it translate into action for ourselves, for our families, and for the people around us. Because in glaucoma, the greatest tragedy is not the disease. It is the lack of awareness before it is too late. Routine eye care is very important, but sometimes it focuses mainly on vision and pressure. Glaucoma can still develop silently in between visits or without obvious symptoms. That is why we must go beyond routine care by improving metabolic health, vascular function, and awareness. Glaucoma does not take vision suddenly. It takes it slowly, quietly, over years. And that is exactly why we have an opportunity to detect it early, to protect the optic nerve, and to go beyond routine care. Because eye drops can control pressure, but your daily habits, your metabolic health, your circulation, these are what truly support long-term vision. If there is one message to remember, it is this: don't wait for symptoms to take care of your eyes. Protect your vision before it is affected. Because once lost, vision cannot be restored. But with awareness and the right approach, it can be preserved. Take care of your eyes, and they will take care of your life. Vision is not just the ability to see. It is the ability to live independently, confidently, and fully. Thank you. Founder, Holistic Wellness Foundation, IMFAL, Healing Beyond Boundaries.